Can folks hear us?
Yes.
Yes.
Yep.
Okay, wonderful. Great, thank you. You have King County on the line. Thank you all who are able to make it on short notice to this call. My name is Callie Knight. I work on external relations for the county, and I'm going to hand it over to my colleague Hamdi Mohammed, who's going to provide a quick welcome.
Great. Callie, are you taking notes on this? I just want to make sure we get everyone who's on the call. Are you able to see who's joined?
Yeah, so we can see the number of people on the call, but it would be helpful if folks could either chat into the Skype box if you're on Skype, or to email me at with your name. It's cknight@kingcounty.gov, and you all should have gotten an email from me last night. If you want to just reply to that with your name, that would be helpful as well.
Great.
Perfect. So yeah, if anyone needs to email Callie, do that. I just want to make sure we have strong follow-up after this call. Thank you everyone for joining. I know I've talked to probably a lot of you guys already about the White Center facility, and I think this is an opportunity for us to all connect and get a briefing on what's going on in the community, and also for folks to ask questions and have some of our county leadership with folks from public health who are on this call with us, and we'll be able to answer any questions that folks have. Also, I'd like to ask if folks could go on mute. There's a lot of background noise. So if we could take a minute to just mute ourselves if we're not speaking. Thank you. Just to avoid those background noise. So yeah, like I was saying, so this is someone's driving. Yeah, I can hear the driving. Let's try to go on mute. I'll give it a minute. Are you able to mute the organizer?
Yeah.
Okay. And again, my name is Hamdi. I work for the Executive Office of Equity and Social Justice as their immigrant and refugee policy advisor. And so I'm happy to also help out with any follow-ups that folks have. Me, myself, and Callie and Michael on our team will be following up with folks. If anyone has additional questions, we'll be able to answer those after the call as well. So I just want to make it clear that, yes, we are doing this briefing on this call, but we also intend to stay in. There's a lot of background noise.
Okay, I'm gonna.
Freaking on mute.
Sorry, guys.
Callie, is that you with all that background noise? Okay, that's a lot better. Hugo, so I'll turn it over to you.
Yes, thanks. I just wanted to speak up and share that we're communicating with our regional boss, including state, on economic impacts to the surrounding communities and businesses. And we're really trying to be proactive into going one-on-one meetings with the businesses surrounding the community as much as possible. And I'm out in White Center currently, and we'll be I've seen some of you already out in the community. We also in following up with any concerns for the businesses in the area directly. I believe also I'll go ahead and let John share some thoughts.
Yeah. Good morning, everybody. This is John Taylor, Director of Local Services. We had originally scheduled this call with many of you to talk about kind of a emphasis on homelessness in White Center and trying to really move the needle on homelessness. And then we were broadsided by this unprecedented public health crisis. And the county has been mounting a really aggressive response to it. On a happy note, just know that the tacos that we had scheduled for the meeting today have been delivered to Camp Second Chance. So there's a silver lining for us having to use this pretty clunky format to have a public meeting, and we apologize for that, but we're trying to limit people's exposure to the virus and minimize public meetings. So as part of that response to this unprecedented public health crisis with the COVID-19 virus, the county's gone out and established isolation and quarantine facilities, of which there are now 4 sites. One in Seattle at Inner Bay at 531 Elliott Avenue West, one in Seattle, in North Seattle at 1132 North 128th Street. There's one in Kent at a hotel that the county has acquired. And there's the one that we're going to be talking about today in White Center at 206 Southwest 112th Street in Top Hat. Now, we know that citing this facility was a surprise to the community, and we appreciate that people are justifiably concerned and have questions about it. And our goal today is to sort of bring some people to bear in this room who are subject matter experts who can talk a little bit about the site, how we're establishing the facility, the timelines, what'll be there, who's going to be there, what services will be provided to them and to the community to make sure that the community is safe. And then we just want to hear from all of you about your concerns, if there are other things that we can be doing to ensure that the community has confidence that people in the community are being kept safe. And also, you know, sort of next steps. Are there things that we need to be doing on a regular cadence so that we have a dialogue with the community and are continuing to address your concerns? Kind of before we start, I just want to set some group norms for this call. And again, because giant conference calls are not an optimal way for people to communicate, just set, you know, some basic norms for communication. So first is, we realize people are upset. I've had conversations with a lot of you, but please assume good intent. We have a public health staff that have been dealing with this crisis for over a month and have been working incredibly hard to ensure that everybody in this community is safe, which is why we're taking very rapid, drastic actions to ensure the safety of our community. When you're asking a question or making a comment, if you could identify yourself, that would be great. And this is going to be challenging again because of the conference call nature of this, but please try not to step on one another. Let people finish speaking before you ask a question or make a comment. And I know that there are many people on this call today, and you guys did some introductions before we got on, but we're joined by both Councilmember Joe McDermott and Bury Mayor Jimmy Mata. And if they would like to just kick this off by making a few comments, that would be great. And I guess I would start with Joe McDermott.
Thank you, John, and thank you, everyone, for participating in the call. I, too, have heard from many of the people in this conversation and others in the community, and understand the surprise nature of the communication, and the immediacy of the communication, how little or warning or frankly no forewarning. And I look forward to this conversation, this call being a chance to address many of the questions you have and offer information about how the quarantine, isolation, recovery location will work. And my goal is to offer some information and therefore assurance to this conversation. And I look forward to participating with everybody.
Mayor Mata? He may be wrestling with his mute button.
Yeah.
Well, he may jump in at some point. If he does, by all means, we'll welcome whatever comments he would like to make. What I'd like to do now is just sort of do quick introductions in the room here, and then I'm going to hand it over to Facilities Maintenance Division to talk a little bit about sort of the facility, how it's going to be constructed, and how it's going to, when it'll be online. And again, John Taylor, Director of Local Services.
This is Christina Gonzalez with the Facilities Management Division.
Sherry Hamilton, King County Department of Community and Human Services. Nina, Public Health.
Jenny Houston, Executive Office, Government Relations.
James Bush from the Executive's Communications Office.
David Daw, Department of Local Services.
Michael Padilla, External Relations Associate with the Executive's Office.
All right, and with that, why don't I hand it over to Christine?
So I'll just say a few things. To start off, we have 2 trailers that will be delivered, or one that has already been delivered to be delivered, and we think that they will be able to be set up and established with utilities by about mid next week. So to start, we'd have 2 trailers. That's 4 units per 4 rooms per trailer, so 8 units to start. Ultimately, we plan on having 8 trailers with a total of 32 rooms, but that is not feasible until we have the demolition of the building on site. In terms of security, we will have a contract security officer on the perimeter 24/7 to manage both folks coming into the facility and out of the facility. So if there's any point in time that one of the folks that is intended to be in isolation and quarantine, the security officer would be letting public health officials know that that person is leaving in order to help secure the community members outside of this facility.
Great.
Hello, this is Sherry Hamilton with the Department of Community and Human Services. Isolation and quarantine is to help keep the community safe and by containing the illness. We must keep our hospital beds open for those who need acute healthcare needs. Creating isolation and quarantine helps us to serve those individuals outside of the hospital. I want to be clear about who we are serving with the isolation and quarantine. It's people who are traveling. It's people who have had a direct exposure to someone, perhaps with the COVID-19 illness, who cannot self-quarantine or self-isolate at home, perhaps because they have a family member with immune-suppressed conditions, and people who don't have a home. So there are a number of different scenarios where someone might need the isolation and quarantine sites. We will have specific priority criteria. We're still working on those, exactly how we will identify people for admission to the facilities. We're not quite there yet, but we're very close. And as Christina said, we will have security on site. We also will have at least twice daily check-ins with everyone who is there. We will be monitoring their symptoms. We will be identifying what needs they have, and supplies will be dropped off to them as needed, so they won't need to leave to go get food or ibuprofen or anything. We will be supporting the individuals in each unit. And I'll stop there.
Okay, so I think with that, we really wanted to leave the vast majority of the time for folks who have questions to ask them, and we'll do our level best to answer them here. And if someone asks a question that we don't have an immediate answer for, we'll be sure to get back to you with an answer as quickly as we possibly can. So with that, I would open it up to questions or comments.
Tracy Record, journalist. Question. You mentioned you'll have people on site around the clock. What about medical people there?
Medical staff will not be on site, but as I said, we will be monitoring them at least once or at least twice daily. We will be checking them for their symptoms. We will be giving them a phone number to call if there's any change in their symptoms. We will be working closely with every person that we have put into these facilities, but we will not have on-site healthcare workers.
Wow.
Following up on that question, so
would you mind saying your name?
This is Rebecca.
Thank you.
I wanted to know if they are going to, can you hold them accountable lawfully for leaving the facility, or is it just a notification of if they let the security guard know and he refuses? Are there laws in place that can keep them there? Are they signing contracts, you know?
This is Sherry again. There are public health rules around if they are ordered into quarantine. I'll get back to you with some additional information on that.
This is Mayor Mata. Can we make sure that you all get that information on the public health and what their constitutional rights is with changing them there? I'd like to get that information as well. This is Mayor Mata from here.
Yeah, absolutely.
Yeah, we will. We'll get you what authorities there are and how we would deal with that, and we'll get it out quickly. Next question.
So, this is Julie Hyatt, Fire Commissioner with North Highline Fire Department. One question is, will you be contracting with TriMed or anyone like that if you need to transport anyone who becomes ill at the facility? Or are you looking for the fire department to aid with that?
We are working with EMS and TriMed, yes, for transportation.
And just, one kind of at a higher level, one of the concerns I've heard from folks is this going to overwhelm the local emergency responders, and are we going to be paying for that? And I think everyone should just know that, the Congress just appropriated $8+ billion for emergency response. The state has appropriated money. We're going to be seeking money to deal with all of the impacts of this. But at the moment, we don't have any plans for direct transfers to any of the emergency responders. But I think that's one of the things that we're going to be working on as a region.
I'm a resident of White Center for the past 50 years. So when you talk about the load and the obligation of the local fire department to respond, by exposing them to the possibility of contracting this disease, if they are to leave to another call directly after, how are they going to secure themselves, and how are they going to make themselves less contractable to others that they'll be responding to?
And I think to the greatest extent possible, we're trying not to have the local fire department be responsible.
We're still working on the transportation.
What?
Hello, Mayor McDermott. This is Vanessa Villalobos, Balorico, working in White Center. Are you aware of the more than 10,000 people that have been opposed to this? It looks like we're beyond that decision making, but the residents that are in the direct area that speak Spanish and that do not have access to this call have communicated in different ways that there is fear, and what portion of funds from those from the percentage that's going to come to Washington, what portion can you secure for the immediate White Center community? Because there's going to be impacts.
Yeah, so
the 30 quarters. So where is the planning for that? What can the community know?
Yeah, absolutely.
To be protected. Thank you.
Yeah, Vanessa, thank you so much for that question. So we transmitted an emergency ordinance to the county council yesterday. They'll be taking it up on Tuesday. We included $150,000 for outreach and translation services, and the executive's office is actively seeking out a philanthropic partner to match those funds or even exceed those funds. With the focus, can somebody put themselves on mute?
Yeah, it's down at the bottom. You don't have Skype. So it's in that email. Yeah, okay. Kind of go down toward the bottom.
Hey folks, can I ask you to put yourselves on mute while I answer the question around outreach to non-English speaking communities? Thanks so much. So Vanessa, like I said, $150,000 in the budget that we transmitted yesterday. The county council will be taking it up on Tuesday. The CDC and the city of Seattle have translated some fact sheets, but again, the information is changing so rapidly that we know we need to have funds not just for translation of materials, but for interpretation as well as closed captioning and interpretation of press conferences, for example. And so we're working on identifying partners who would either match or exceed the funds that we've sent over, and we will be working specifically to push that money out to community-based organizations that are working with impacted communities, such as health workers, people who don't have access to sick leave or health insurance, people who don't speak English as a first language, et cetera, et cetera. So that work is happening. It is in process. I don't have a final number to say right now, but absolutely we'll be prioritizing impacted communities.
Thank you. Another question was regarding developing specific criteria around admittance. Is there ways for the community to be a part of that committee work or decision making? Because that's, again, part of the fear, especially the elders.
Yeah, absolutely. I appreciate that feedback.
And this is Hugo Garcia, Local Services. Just wanted to add to Callie's comments on outreach to and specifically to the Spanish-speaking community. We have a partnership that we started in, and we'll be using it to deploy information as well through a local Spanish radio station. Additionally, on the ground in White Center myself, I'll be here in the area for the 3 weeks, and I am able to meet with community members to share information as quickly as we get the information translated to make sure that I can help get information out to the community as well. Being an immigrant from Mexico myself and understanding the dynamics of folks that don't want to stop working, I understand it's important to get information out in a relative manner that folks can relate to. So we're working hard to make sure that we do that as well.
Okay, next question.
I have a question. So when you reached the decision to put...
Can you say your name, please?
This is Rebecca again. When you made the decision to put these centers in these communities, was there an equity analysis done to talk about the effects that these communities are going to experience? Because there's people in these communities that don't have proper health coverage, that are low income, that are minorities, and have those considerations been made before reaching this decision?
I appreciate that question, Rebecca. This is Christina Gonzalez again with facilities to talk to the siting. So I will say that King County is looking across the county at different sites for isolation and quarantine facilities. These are just the first of the sites that are to come. We're also looking at sites both in kind of North King County and at the east sides of the county. We needed a county-owned facility to make permitting less challenging and to be able to do this as quickly as possible given the emergency need. And we also needed to be readily accessible to utilities. So that really narrowed down the number of appropriate properties for this. And so this is just, again, like I said, one of many facilities that are going to be to come. So in terms of looking across the county to site many of these facilities.
I understand your response. So one thing I want to say is you're bringing us into poor communities and you're telling us that there's only going to be one security guard that could try to keep people that can voluntarily leave. I want to understand how you expect us to be confident in a system that's telling us and not even helping us be protected.
That's a great question. I would say that we are absolutely going to be evaluating the security needs, and if at some point we need to increase that security, that's something that we're absolutely going to be willing to do and to watch for.
I don't think that's a some point question. I think this is something that we need to do immediately as the spread of this disease is continuing and we are doubling in the numbers and the cases reported every day. We should not be taking this risk and putting poor communities at risk. As elected officials, we expect you to keep us protected always. We elect you to, this is something that concerns all of us. All of King County is affected. But the fact that this is being directed at poor communities is a huge concern to us. And this is going to matter when local elections and all these things come. Because we are voting for people that are going to keep us protected all the time. And at this point, I don't feel like that's the case.
Agreed. So, yeah, thanks so much.
Okay, my name is Mark Upkus, and I'm a White Center resident. And I appreciate the concerns that people have. I'm married to a public health nurse, a public health official in King County. And I also live in White Center. And I've raised my kids here. And I would like to offer perspective. I'm honored that White Center is able to help address and help support King County in developing a strategy that never had to be developed before, in a crisis that we've never experienced before. We are in new ground here. You are all asking good questions, but the county I'm honored that we're part of the solution here to address people who are sick and don't have an alternative. And if we can scoot over, just a minute, and if we can scoot over and help do our part, that's a good thing for White Center. The whole notion
I wanted to be able to please add my name is Sister and I work at Chase Seattle Club. I have grown up. I went to Evergreen High School. I went to Cascade.
Okay, I'm not arguing that. All I'm saying is that we need to. These people are professionals who are trying to do the best they can. They have opened up these phone lines for all of us to share our perspectives, and everyone's asked good questions. But I just want to be clear. I am honored that we are part of the solution here, and I believe that King County government and our elected officials are doing the best they can to try to figure out how to move forward and keep everybody safe. And all I'm saying is, keep going, guys. You're doing a great job. Get better, and we'll get through this. This is not the end of the world. We will all get through this.
This is Anna speaking. I'd like to add a comment to that.
Okay.
Will you guys please mute yourselves? It's very hard. I do appreciate what you just said, fellow community member. This is Anna. I'm also a White Center member, Westwood. And I do believe, the county, the officials, everyone is acting up and really stepping up based off of the options that they do have. So we do appreciate the response overall. My main concern is, even with the limited options that we have, just because an option is there may not make it the best one. So a couple questions I have is, one, our end goal as a community is that we don't have this center in our community because of the surrounding people in that area can be in a different place. Because one, if there is a chance of this spreading at all, even with all the precautions in place, this is not the community that we want to spread into. Because of the elders around the neighborhood, the children, the schools, and the impact, given that most of the people here don't even have health insurance. So just thinking, if this does spread, this is not the place you want it to spread, because it will spread rapidly. So how can we contain that?
It's spreading rapidly now.
Okay. So let us address that question. That's a really fair question. I've heard that from a bunch of people. Obviously, we want to establish these in ways that are safe for everybody. The whole point of having these facilities is to protect the community.
And this is Sherry. The purpose of isolation and quarantine is to contain illness or reduce or prevent the spread of illness. And that's why we're setting up the isolation and quarantine locations. Again, it's for people who are traveling and need a place to go. It's for a situation where maybe one roommate is ill and can't stay in their dorm room. We need to move them somewhere else. It could be a first responder who rushed in to provide assistance in a situation with someone suffering COVID and their spouse is dealing with cancer and can't go home. There are many reasons why an individual would need isolation or quarantine, and that is the purpose of these units. They are individual units that we are putting people in so they can rest and recover. Perhaps they will develop symptoms, perhaps they will not after 14 days. But the purpose is to try to protect the community and reduce the spread of the illness countywide.
Which is definitely understandable. Everyone here, I believe, agrees, we need a space. The question is this your only option? Can we put it in a different center where, should it even spread at all to someone else, it can impact the region that or space that.
Okay, we've heard that, but every neighborhood, every single neighborhood does not want this. Every single neighborhood in King County will reject this. It doesn't matter. It doesn't matter.
Okay.
It's not about the rejection. If you do have other places, can we put them first? This is the last option. No, can we make White Center the last option?
Okay, so I'm just going to again, sort of the group norms. Let's let people finish their thought. Let's not interrupt people. And I just want to reiterate, this is not the only facility. As I said, there are 2 in Seattle, there's 1 in Kent, and there are very likely to be more as time goes by. And we're looking at those locations too. So I appreciate 100% that folks who live in White Center are concerned about this. You're not the only community that's being impacted.
That I wanted to make earlier. I wanted to finish a statement that I was trying to get into really quickly. I'm Patricia. I am Native identified, Native and Black, and grew up in White Center. I work in homelessness advocacy in Pioneer Square, so we are probably going to be one of the first communities or organizations deeply impacted, especially our homeless community. I was also asked to participate in the White Center community. As a Native person, I really want to importantly note that there have been historical epidemics in the Northwest, including things like Whitmore and rashes like smallpox. So I want to note that the reason why a lot of people, especially people who are refugees, indigenous identified, they're going to be triggered about this, and they're not very easy around people who have been exposed generationally to epidemics before. And that although this is not at all, anything that our community or governmental organizations want, there have been historically times when it's been used against communities racially. And so it is very difficult for me to know that there are going to be people who are upset and do feel triggered by this because of historical trauma. And so they're going to want to be able to have a space to be able to ask questions and not be dismissed or excused by their concerns, because especially considering that this is a cross the street or not just a demonstration public parks. A lot of these seems like the reductions within the area that I know, and they're a little bit that I
cannot hear her. I cannot hear her.
But I have a lot of background noise. I'm going to go push down because I'm very happy that there's being so proactive about work and not reactive. They keep it and they're making the most of what the community and we're discussing epidemic
Okay.
Yeah, so folks, let me jump in really quick. This is Callie. Some folks are entering questions on the instant message, and Bianca, I want to just address your question. It is wanting to know if the folks identified for these isolation and quarantine facilities across the county would be based on actual testing or just based on exposure, and the answer is both.
This is Jim Otto with the City of Burien.
Again.
Mayor Burien, I wanted to talk a little bit about emergency rooms in Burien. I know that from White Center right now, there's some members that are concerned and scared of, this facility, but I want to thank you because I do believe that anywhere we have an emergency room, we should have a facility where we can take people to be quarantined. Specifically with communities that, live in poverty. We are the janitors, the cab drivers, hotel workers, we clean countertops, we're working all the time, and so to me it's important that we have a facility to be able to take some individuals. Like for instance, in my household, I have my mother, my uncle, my stepfather, my daughter. I have more than one person living in my house, so if that happens to be the fact that I have an individual in my family, or I myself end up getting sick or contaminated, I'd like to make sure that there's enough facilities to where I could, be in a place where I'm going to protect my family. So I'm happy that that's moving forward. I would like the county to, reach out to the city of Burien. I know you have been working with them, but if this continues to spread, Burien is right in the target's eye because of the emergency room. So if anybody from White Center or SeaTac or Normandy Park or Des Moines, we're not going to reject them from Burien in our emergency room, and the hospital is going to make sure they do everything they can to make sure that they're protected. And in that, it leaves us with the situation that what do we do as people are getting quarantined? I hope there's a plan out there of working with the Highline Hospital. I do know that there is one individual that's been treated with coronavirus in the Highline Hospital. That's all we know. We don't know if there's been more cases, if it continues to spread around Burien. So I'd just like to make sure that we're paying attention and keeping an eye on it. That's all I have to say today.
And this is Sherry. King County is working very closely with all of our hospitals. And again, isolation and quarantine is meant to assist people in the community and to reduce the need for going to the emergency rooms. We must keep the hospitals available for people who have acute healthcare needs, life safety issues. Public health has done isolation and quarantine before. Overwhelmingly, the individuals that are there are grateful for a place to rest, in case their symptoms develop, and to keep their family members safe while they're doing it. So we do have experience with this.
Hi, this is Selma.
Okay.
Can everybody hear me? I'm off mute.
Yep, you're on.
Check. Okay. Thank you. I do appreciate everybody's efforts. I work at the Gates Foundation. I'm a public health professional. I'm a board member at the West Seattle Food Bank, and I worked at Swedish Medical Center, so I totally understand keeping a quarantine site outside of a hospital location. This decision, however, I believe will undermine the efforts to reduce disease spread, given how the quarantine site will work outside of the historical implications that this has for the community. From a public health perspective, if there's only one security guard for a quarantine site that will host over 40 potentially COVID, well, they are COVID positive people, it's a ratio that will allow the possibility of those patients to be outside, along with the bathroom facilities, the utilities, being outside as well. It seems as if the quarantine site is not going to work as it should work as a quarantine site.
Thank you for your question. Again, this is Christina with Facilities. Just to clarify, we did hear the feedback about the porta potties and having to go outside. So we actually have changed our plans. We actually are not going to use porta potties. We're not going to be opening these facilities until we are hooked up to sewer and water. So that won't be an issue. And like I said, we're absolutely going to be evaluating on a regular basis the need for security. And if there's a need for higher security levels, then we'll absolutely take that into account.
My second question is, since this spreads through air droplets, how will you minimize that type of exposure to the apartment complex that's right behind, that's filled with young women, children, the elderly? I don't understand.
So the question was, if this is passed by air droplets, how are you going to minimize exposure to the apartment complex behind the facility?
They won't be outside. Maybe I'm not understanding the question. The individuals are inside their hotel rooms or inside the modulars. So I'm not understanding how the transmission is.
Yeah, I think we understand that folks are concerned about the proximity, but really if this facility operates the way it's designed to and people are contained to the modular units, which they will be, there's no risk of exposure to the public in the adjoining buildings or houses or anywhere in the neighborhood.
Okay, so will the modular buildings have air ventilation? Yes. Because that's a requirement from the CDC.
Yes, absolutely.
So then they will be breathing, and those droplets will be going through the ventilation system, effectively being in the air and spreading.
So the requirements for this facility, my understanding, this is Callie, is that it has to have separate HVAC systems and contained airflow. So that it's not accurate that the air would be circulating out into the broader community.
I don't know that I could believe that, one. And two, I want to understand how many parcels are in King County? What was the process to select this parcel?
Yeah, like I said, we've been looking at all the King County owned parcels, and we needed.
How many are there?
We can send that information as a follow-up.
Why would you send that information as a follow-up?
We don't have the numbers in front of us.
So then how did you go about this process if you don't have those numbers in front of you?
Like I said, we were looking at parcels that had the option of having accessible utilities hookups, and there are very small
does
number.
not have that option.
There is.
That's something you're working on until next week.
Yeah,
so it's not accurate to say that this doesn't have utilities hookup. It does.
And the work that needs to be done is to hook them up to the utility trailers, to the trailers themselves.
Right, but then that means it doesn't right now have utilities. You're hooking up those utilities to that trailer and choosing this parcel. Why can't you choose a parcel somewhere outside of this and hook up those trailers to the utilities? Why would you designate this parcel?
So a couple of things. So we'll get you the total number of King County owned parcels in unincorporated King County. That number is, to use a technical term, ginormous, but we can get that for you. What we were looking for here were parcels that were near utilities. So it doesn't mean there's like a pipe running and sticking out of the ground, but there is a sewer line right out front and there's a water line right out front. That was the criteria. And then it needed to be a parcel that was big enough to accommodate these, and also needed to be near hospitals, so you're taking load off of hospitals. When you start running it through those filters, it narrows down pretty quickly to very, very few parcels. And I appreciate that people are concerned about this, but we're trying to move quickly to stem a public health crisis. That's why we're doing this so fast. Because the consequences of not doing this to the community could be disastrous.
Sir, the consequences of doing this to this community seems like it's a disaster.
Hi, folks. Sorry, we can't hear.
All right, so next question.
Go ahead, Vanessa.
I was commenting, sir. My name is Vanessa. I believe what the young lady is saying is that we are already at a big risk. We are already knowledgeable of the impact it's going to have, and it's a little difficult to have confidence in a plan in place that you're describing right now without the appropriate preparedness. It seems, and I'm speaking on behalf of several others that are with me, that this seems like an experiment, and because those other parcels are unknown, you can't give us that information right now. It's unincorporated, so it's not a just process, and I think we can talk about this for the next hour, however much time we have, but I think I feel that I need to communicate to you directly. The community does not want this facility here. It's going to cause death and a heavier burden on an already disenfranchised community. You need to know that.
That's not accurate.
To this facility. And what's going to happen after the 32 people, you know, it's going to get overpopulated. We're going to have death on our hands, so we're asking you to please consider a new site.
Vanessa, sorry, I want to make sure that you're able to say it. Was that the conclusion of your remarks?
Yes, sure, I'll restate.
Okay, sorry, you dropped out.
No, I'm not. I'm here.
Okay.
I'm here. My final statement was that the community is opposing this. People are not in agreement. And there's over 10,000 people that are behind my statement. What can we do for you to please consider a different site?
So this is Callie. Thank you, Vanessa, for your comments, and I really appreciate the honesty and the pushback there. So I just want to say a couple of things. The point, and I can't reiterate this enough, the point of these quarantine and isolation facilities is to stem the spread of disease and keep communities safe. So respectfully, the statement that death is attached to these facilities, we disagree, and I worry about that messaging being widespread amongst community. Again, we are committed to keeping you updated as often as we have information. We are appropriating and asking the county council to provide us funding so that we can ensure that community is supported and has the information they need about how to stay safe, particularly in impacted communities. And at this time, White Center, among the other 3 sites, they are being placed. We are actively searching out other sites. And so I know that that is not the answer that you want to hear, but I can make a commitment personally that I want to be in touch. I want to problem solve and work through the differences of opinion. And I want to make sure that we are doing the best that we can as your local government to provide information and resources in this difficult time in this rapidly evolving public health crisis.
This is Councilmember McDermott, and I'd like...
Commissioner, I have to run to another meeting. This is Julie Hyatt, Fire Commissioner. So one thing I wanted to ask before we got the call is, the North Highline Fire Department hasn't had any kind of meetings or anything with you guys. Is there a way we can set up a time to get together to make sure we're coordinating and prepared?
Yes, absolutely.
Who should be contacted about that?
Yeah, so it should be me, Callie Knight. It's CKNIGHT, cnight@kingcounty.gov.
Okay, so we'll contact you and get that set up right away. Thank you.
Yeah,
You're welcome. Councilmember McDermott.
Thank you, John. This is Joe McDermott, and I wanted to let everybody know that the funding Callie was referring to, the emergency funding the executive is requesting, was transmitted to the council yesterday, and the council will take it up and approve that funding at its meeting on Tuesday. So that emergency funding will be in place for translation, for community support, and such as is needed.
Hello, everyone. This is Anila Ashdali. Yeah, thank you. This is Anila, and I am with the Washington Immigrant Solidarity Network, the Muslim Association of Puget Sound, the Faith Action Network, and I live in West Seattle and frequent one of the mosques there in White Center. I just want to say real quick before I speak, I hope people put their phone on mute if they're not speaking, because I hear some background noise. But I have several questions and concerns from the community, especially the marginalized community members, Black and brown folks in particular, Somali and others who live there, including refugees and elderly populations. And I have several questions. The first one is, how long are people going to stay in this quarantine site? And are they tested, or are they going to be regularly tested as they are in this site?
So, Anila, thank you so much. Public Health can speak to that.
If they're waiting for results, they'll be there until the results come back. If they are negative, they'll be discharged. I'm not sure.
If they're sick, how long are they going to be there for?
Until they are recovered.
And how long is that typically?
I'd have to get back to you on that question. I don't know for certain the duration.
There is no typical.
Yeah. Remember that the consistent messaging is that 80% of the people who contract this will have mild to moderate symptoms. That has been a consistent message from public health, from state public health. We will be working with individuals if they become sicker and need immediate or crisis intervention. We will send them to the hospital. We'll be monitoring every person at least twice a day on their condition, and on an individual basis, we will serve them.
Anila, you said you had some other questions. I want to make sure you have the opportunity to ask them.
Yeah, thanks, Callie. So I think there needs to be some clarification about how long they're going to be there and how frequently they're going to be tested, because they are remaining in close quarters and likely will be continuing to spread. If even one of them is infected, even if somebody gets tested and they're staying there, they're going to potentially come into contact again. So I think there needs to be some clarity around that. I think it's really...
I think it's also really important to have 24-hour medical staff, at least one person there. I don't think just checking symptoms twice a day is going to be enough. If this is a site of people who are potentially infected, I really think it's important to make sure there is actual medical staff there on site, along with greater security. And with the additional funds that both the federal and state and local institutions have provided, I hope there will be an investment in medical staff on site 24 hours, along with greater security. Is that a possibility?
Daniela, yeah, thank you so much for that feedback. And I think in light of new funding that's available, we can explore what that looks like, understanding that what we can say determinately today is that there will be a security guard and no 24/7 medical. But things are changing moment by moment, and your feedback is essential. So thank you.
I think that's important, and I also think, thanks, Kelly. I also think it's really important to talk about the fact that there are, at least in White Center, there are no medical facilities nearby that I'm familiar with. There are schools, mosques, elderly communities, apartment complexes very nearby, but no actual medical facilities. And what kind of testing or medical services will be provided for the community nearby? Is that something that some of the funds can also go toward, is establishing some kind of clinic for people who are not quarantined but have symptoms or might not even know to get tested or anything else? Like, can there be a facility that they can go to, kind of like a community clinic that can be established near these sites because of the risk to the rest of the community?
Yeah, so I can just say that feedback is well taken, and it is something that we can certainly look into. I think we will need to coordinate strongly. The state is taking a pretty big lead here with working with medical providers and health professionals, and so we would want to coordinate with them, and we can look into it. But right now there is not anything that we are standing up. But again, these are important things that we should be looking into, and definitely will.
I thought the selection at White Center happened because it was close to health facilities. I thought you said you specifically selected the White Center facilities because it was close to.
Whoever's alarm is going off, if you could stop that, that'd be great.
Yeah, so we will look into so there are criteria about proximity to health facilities. I just don't know exactly what the mileage is on that sort of filter in identifying sites. And so we know that Highline is a close by medical facility. It maybe isn't as close by as exactly in the community, but we can get specifics on what that criteria was.
And this is Sherry. I want to remind you again that it's one person in a room. It's not, they're not all together. They have their own room with their own bathroom. So there aren't shared facilities amongst the individuals that are staying there.
How about food and other things, services that are provided to them, and the people who deliver the food, and the potential touch and crossover between delivery of food or other essentials to folks in their individual rooms?
It is a drop and go. They will be, we will talk to them every day. What are your needs? And someone will drop and go. I am outside your door. Leave the supplies and go. And yeah, there is no person-to-person contact in the delivery.
Got it. Thank you for that. And yes. Neil, I still have just two more points, and one of them is, in addition to putting up some kind of community clinic, which I think would be the right investment of funds in the nearby community, in White Center someplace, I think it'd be also important to establish a hotline specifically for each of these locations. So one hotline specifically for White Center community residents who might have questions, concerns, issues, a 24-hour hotline or something like that for them to be able to get their questions answered. I think that's really critical. And to have some kind of translation services for folks who might not speak English as their first language or at all. And I think some of the languages specifically, besides Spanish, would also be Somali and other languages there in the community. So I would put that as an additional ask for White Center specifically, and likely the other locations too. And the final point on the investment, I do think we need to have investment in the actual community as well. I understood the point from the gentleman earlier saying he's honored to have White Center serve this role. Certainly not everybody feels that way, but at the very least, if the county, the state can invest in White Center as a community, building infrastructure and other things, I think the cost and weight and burden of being a quarantine site can be a little bit alleviated, although of course I know it's not going to go away.
Great,
thank you, Anila. And because we're reaching time, folks, I think, Anila, your comment about establishing a hotline, one of the big things that we wanted to make sure that we talked about with folks today was the best ways to stay in contact and keep the community updated as things are rapidly evolving on basically a moment-to-moment basis here. Public Health is doing a daily briefing, but we want to make sure that we have a direct line of communication. I think a hotline is one idea. We've talked internally about maybe doing a daily briefing, putting together a listserv, or having a weekly call or something like that to keep folks updated and apprised on what the latest guidances are from Public Health and what the latest is specifically to the siting of specific facilities. And so we want to commit to doing that, and I don't want it to sort of be an open-ended question of what do you all need, because I know communication styles are different amongst different people in the community and on the phone. But would it be helpful for us to put together a listserv, to host a weekly call, and or have some kind of specific email or hotline for folks to be able to ask questions?
Yes, that would be helpful since we can't meet in person currently. We still have questions that are answered, and we don't have trust in the system. We feel like you're failing us.
And we feel like we should choose a different location.
Hi, my name is Mohammed. I'm with Abubakar Flying Star here in Tukwila. Most of our community comes from White Center and Kent, and the congregation is actually worried. Since yesterday, there was a lot of people coming to me questioning about the reason why King County is choosing on their backyard, both places. They're just saying because we can't speak ourselves, the county is taking advantage of us, which I hear whatever you guys said all day. I was on the call listening, and although I agree with you, some of the decisions you made, otherwise there was no community input to begin with, and community is worried about this, and you guys didn't consult with anybody. You just dump containers next to their houses or their apartments, and most of these communities, some of them don't even have medical coverage. Who's going to take care of them? The worry is extremely high.
Thank you. I'm sorry I missed your name at the beginning, but I do appreciate that feedback. We as county staff do appreciate all of the feedback. We hear that there's a lack of trust and confidence, and we're going to work our hardest to earn that trust and build that confidence and open lines of communication. And we've all got to head out, and so we need to wrap up the call. But please watch out for a follow-up email with the notes that we heard and the questions and the answers that we're going to be providing. This is not the last conversation, but we want to thank you all for making the time to talk on such short notice.
Sorry, can I just before we leave, I just want to say one thing. It sounds like a decision has already been made and it's not changing. So we really do appreciate you guys. So we really do appreciate that you are taking the time to listen to us now, even though it would have been better before. So we just ask that, whatever decisions you make forward, to keep in mind all these concerns and to take those extra measures because of the state of White Center and the people in White Center. We're not against having it in the community. We are against focusing and starting here for sure, because we're going to need these sites everywhere as possible to help those people in need the most too. So as long as you guys just keep that in mind and try to do even greater than what you're already doing, that would be appreciated.
All right, thank you so much.
Thank you for that last comment.
All right, folks, we're hanging up. Thank you so much.
Thanks, everyone.
Thank you.